all for coming on. I want to thank you all for coming on to listen to this topic. I think it's very timely, and I think it's one that probably we would need a part two of, because it's something I would like people to, give their thoughts about the topic, or the health and economic impact of menopause, and what is being done about what we are going through this process. And you can talk about, I want us to discuss, if there should be policies in place to help women in the workplace when we are going through such a dramatic change, life
It's not hearing you.
So I think I had a little bit of a technical difficulty just now. So I'm back online, hopefully. Right, I was having some technical difficulties setting up for the whole evening, right? But this is a topic that I really wanted to speak about. It's one of the more timely topics that we have, the health and economic impact of menopause. And I want to thank you all for coming on. I would like to know what you think about, as we discuss, I would like to throw some questions to know what you all think. If you think menopause is an important topic, that it should, more emphasis should be placed on it, as so many women are going through this great transition, and will go through eventually once they reach this stage of in their lives, this transition. So we know for sure, those of us who have been through it or going through it, or know somebody who's been through it, or someone like people like us who are going through this process, we know it is a biological process, and it marks the end of a woman's menstrual cycle and fertility. And generally, it typically occurs between the age of 45 and 55. And it is a universal experience for women. So as life expectancy continues to rise globally, more women are living well beyond menopause and spending a lot of their life from that point, post-menopause onward, in this stage. There are currently, and then this is a study that I've been looking at online, there are currently more than 1 billion women worldwide who are undergoing menopause. And I want us to think about it. 1 billion women worldwide. And that is a whole lot, because we know that worldwide there is it's more than 7 billion of us on this planet. So that is 1 billion is a very big number when you think about the worldwide stage. Women who are going through this transition, or women who are postmenopausal. And the study is saying by 2030, the number of women aged between 45 to 55 will reach nearly 500 million, meaning that roughly 6% of the world's population will be in menopause. So think about that. While most menopausal women will live in low and middle income countries, they will also make up a large proportion of higher income country populations. So this is a significant shift socially, economically, and healthcare implications for women, their families, and their communities. So just think about the amount of women like ourselves who are going through it, who need the knowledge, who are being pushed aside, who are, the research on this topic, has now been, been taken up, some heat worldwide. And, many things are yet to be learned about this topic. Yet, with all of this that is going on, menopause remains in the shadows. It is very much under prioritized and under resourced by policymakers, employers, even in the healthcare field, where a lot of us are in, development institution, investments alike, all of these places, menopause has been placed on a back burner. Now, the consequences of inadequate menopause support, however, are not limited to those experiences, but rather are collective and cross-generational, with a lot of impacts to a lot of workplaces. You just think about our job. Many times we are going through this transition, and we have so much symptoms. We have no counseling, no support at our workplace. Sometimes we just take sick days just because we know that we are not up to, up to mark in terms of dealing with patients, dealing with people in general. And it can, if left untreated, can leave a lot of big gaps in the workplace, because it's not something that still remains taboo among a lot of us, a lot of women, to talk about. And people treat you a certain way when you're getting older. So I would like to know, should there be policies, and I'm sending this question out for the ladies online, should there be workplace policies particularly focus on women going through menopause to help them go through this transition? Anybody? I thrown it out to our group. Daily, can unmute and speak. I see your hand up.
Okay, well, where I worked before, there was a very good occupational health unit. So maybe not necessarily have policies, but a woman, so say like they have your clinic access and menopause is affecting clients in this way, women in this way. They should, like your clinic could maybe write the doctor, write a referral letter for them to take to the occupational health department of their workplace. And the doctor there can intercept and see how he or she could find some sort of balance for the client, which is the woman going through menopause, and her manager, to help them to understand this. But in addition to, these should be like how we'll have study days and so forth. Maybe that should be included in a study day, and not just for the women, the men and women managers, so people understand that menopause has, it can really pose problems for some women.
Okay, I agree. Because basically in Trinidad and Tobago, there's nil support, menopause support counseling on the workplace, generally, and every workplace for women. You don't find that women are supported in that way. They're just basically brushed aside and taught up. Well, it's the aging process, so you have to go through that. And it really affects our health, and we know the changes that takes place in every system of our bodies. So to Neil, you send back the question that the point that you were making just now for me. Neil was making a point just now. She was saying something about there should be probably, if not a policy, a support system in place on the job, on the workplace for women. I would want her to emphasize in terms of, so what type of support, or I'll throw the question, what type of support do you ladies think that we need in the workplace when we are going through this transition? Anybody can answer. What you suggest, what type of support you think we would need as women in the workplace when we're going through some of these very, very, very
I would suggest a massage room. A massage room to get massages.
Mm-hmm.
That's it, a massage room. You can get massage. Have a hot cup of tea, herbal tea, something like that.
That's quite interesting. A massage room. That is very interesting. And beside a massage room, what other support you think, ladies, generally speaking? Somebody saying to Neil to say meeting with a group therapist. What do you think about that, ladies, as well? Because remember, menopause is not just the physical aspect, it is the mental aspect. You know, many of us go through a lot of mental, issues, sometimes depression, anxiety. We've talked about a lot of these online. Should we have a therapist? Somebody she's suggesting as well a meditation room, a room in which I guess we could go aside and just be by ourselves for a while, pull ourselves together, and then get back on the job. Do you think any job, especially if you're doing a job like nursing, medicine, teaching, if they would have, and the government would be willing to put things in place like that for women, and is it important enough to put that in place for women? What do you think? Okay. Tanil has some real good points. She said as well, we should have like somewhere outdoors to get grounded. I think I could relate to outdoors because I de-stress a lot when I am outdoor, when I go walking, when I hear the birds and getting some fresh air, it really decreases my stress levels. And I think an outdoor sitting area is a very good idea. But the thing is, if you could get away to go to the outdoor area, because your job is so it takes so much of you sometimes just to get time to go outdoor, or to even sometimes run away to have something to eat is a issue. I mean, Ermin is agreeing with the therapist as well, a group therapist to help with the menopausal process. So make it mandatory. I guess that is something that should be mandatory. With what we are going through, many of us, we really don't want to talk to just any and everybody. And what we want to get our point across, we want to really try and explain to somebody, who is professional and at least know something, about what we are going through. And as she said, and as I was coming to that point, it will generally lead to more productivity in the workplace. Since too, they have extended retirement age now up to the age of 65. This is so much needed right now. There should be, to me as well, I'll come back to Dale point, hold your point, Dale. There should, to me, have exercise programs in place, right, to help with this transition. We know exercise is vital. Lifestyle changes is vital at this stage. So Dale, can I hear your point? Your hand was up.
Um, yes, yes. Well, with regard to the exercise, I want to believe a lot of workplaces may have exercise groups, but it's how much are we willing to access it? I mean, I could
Yes.
just talk for my Lamaze group, and we want to give the information, but the people not coming out. Maybe it's the time, so we're trying to work around that. But when I work with the NHS, well, the NHS they do support menopausal staff, and I think maybe they go through like occupational health or speak to the manager. So like they will have a combination of workplace adjustments like flexible rostering. There's dedicated HR policies. You asked about policies, right? And like actionable interventions, which include you know clothing that comfortable, control
Yes.
workspaces, temperature, paid leave for medical appointments, and they offer comprehensive guidance designed to help both the clinical and non-clinical staff, to work around, navigate through the menopause transition without compromising people's careers.
Very, very strong points, ladies. I agree. I agree. And I would think that, after you're dedicated so much of your life to your occupation, to your jobs, I mean, to me, it should be something that should be willingly given to women at that stage in their life. Seeing how much they have given already, and now their bodies are demanding so much of them, and many of them are still willing to work, but they just don't have the necessary support at work, right? So these points here are really vital. I really agree with you ladies. But I mean, how can we get, a listening ear, someone to at least hear the seriousness of what menopause is and what it is doing, and how many women are going through this and they are alone, right? And they feel like they have no one to talk to. So I think one of the policies they should put in place is I like the having a therapist. I like that. We need to have somebody to talk to tell, to actually, and actually people who are trained in the area, because not because you might be in the medical field as a nurse, doctor, or a specialist in whatever area, may mean that you are specialized in menopausal health, right? And it's something that I have, I would be delighted, to give that support to women. And we have a team, and we're working with women at this stage. And it's something that should be, as I Tennille was saying, and Dale and Ermin, it should be actually mandatory when you reach a certain age group, that you have that, probably once or twice for the month you go and you speak to a therapist, right? Oh, and look at that group meeting, right? And having a group meeting, it is so vital. To me, what we are doing here, at least it helps with part of it, but there's only so much one person can do, you know. So this meeting here is really part of it. Is a way of you could really talk out how you feel, learn more of what you're going through, and encourage more women to do the same, which is so vital. Salima, yes, good night. Need a free psychiatrist to help us mentally. So I agree. That is a very strong point as well. Because remember, I said earlier on, mental health is a big part of the menopausal transition. And many times you don't know if to turn left, to turn right, you know, and we need people who, on a team, who could really, really and truly put forth the knowledge and give women the support they need on the job. And in the long term, productivity will go up because women will feel and know that they are being heard and that things are being put in place for their general well-being. So this is a real big topic, right? And I'm glad to know that you all are thinking in that way, because I am one. I can tell you many times I come to work and I don't feel like myself. I don't feel to be around people, and it's not like I have any known mental issues. It's just I feel so overwhelmed with a lot of the symptoms that I still have, and they still have to go to work, and you pretend or act like normal when you are going through so much, you know. So, and I know that I am not alone in expressing this. I know you all can, many of us can put up your hand and say, yes, I feel that way sometimes. I really don't feel like talking. I don't feel like, you know, mixing and mingling much. You feel like you just want to be in a quiet zone and just, focusing on yourself. Yes, you see where a group meeting will come in handy, so just so many things that can be implemented and put in place for women in the workplace to make them feel heard, listened to, and more at peace with this transition, and there would be more productivity. So this is an ongoing topic, right? Because with what this study also spoke about is women's health and menopause. Menopause is generally diagnosed after, we know, 12 consecutive months without having a period. As we say in this part of the world, 12 straight months without having a period, then you could say you are in menopause. It typically occurs between the ages of 45 to 55, with 51 being the median age of natural menopause. But the journey to this point, known as perimenopause, can span several years, and I can attest to that. I've been going through this for a number of years, and I'm still in the perimenopausal stage, transitioning right now into menopause, and it has been taking a toll on me. According to this research, Ms. Janet Coe, the founder of the Menopause Foundation of Canada, right, and Neil said the same here, and many of us can say the same. The founder, she noted, and in an interview, she was saying women now spend up to half, think about this, half of their lives in a stage of menopause. And I want us to think about that. Each with potential symptoms and long-term health risks that require proactive management. So recognizing it as a critical transition is essential, right? If we have to get a policies in place, and I am one who would like a policy to be put in place for women at this stage in life, because eventually our daughters, nieces, friends, their children, their girl children, female children will go through this transition. And what about, they are coming after us, and I would like that, and you would like them to know that your daughters or nieces of your people that younger women in general, they would have an easier transition than us, because I believe that we are setting the pace, or setting the foundation for policies to take place. So it is vital that I think if we could just, could get at least a policy in place, because we know that this is, as the research says, by the year 2030, 500 million women, would be going through this particular, or going through this particular stage, or going through it. And it has a variety of symptoms. Around between 80 to 96% of women will experience, and we know the most common symptoms are the vasomotor symptoms, which affect up to 80% of of women. And the vasomotor symptoms can occur during the day and night, which we know as the hot flashes, the night sweats, and these would lead, you get to going through these symptoms, you're not sleeping well, and it will contribute to fatigue and eventually anxiety. You get so frustrated because you're going to the doctor and you're not getting the help, right? And there are other physical symptoms, which include, we know, the joint and the muscle pain, as well as the sexual dysfunction, the low libido, low sex drive. And there are the cognitive effects as well, including memory problems, difficulty concentrating, are also widely reported. So these are some of the more reported symptoms. And the hormonal changes associated with menopause can trigger mood swings. You're becoming irritable, and eventually can lead to depression and anxiety. So there, I believe here raises the point that we really and truly need to have some policies in place in the workplace. We know as some people would take advantage of some of these things, but if they have some real tight policies in place for women, and have various support, like the massage room, a therapist, group counseling, that would make a whole lot of a difference. Yes, Dale? I seen your hand up.
I am. If you're going with the policies and stuff, personally, I think there should be a policy in place throughout the country. Working women should be allowed to retire by 55. If they choose to go on longer, but they increasing the working age. And we are in a profession. Well, sorry, excuse, but I'm talking about those who in health. Apologies to anyone who is not in that career. But the prison officers, police, all of those other professions, they get to retire at certain age. Healthcare
Yes,
professionals are exposed to so much, and yet
yes,
they increase in the retirement age. All
I
right.
agree.
What quality of life we have after we retire? So in that policy, if we could get a policy with regard to menopause and stuff, it should be standard by 55 years old, working women could retire.
I agree with that 100%. I totally agree with that. Because I know if you're working as in the police force as a soldier, your retirement age is much younger because of the type of job, and look at what you're doing. Many times and I could talk as a healthcare provider, we were outside facing the COVID while people were at home. Many people were at home getting paid, and we were outside, putting our lives at risk. I got COVID. I don't know about some of you, but I had COVID, and I had to go through that. And that was at the point when the vaccine was now coming into play. I got the COVID, so I didn't have. They were still working on the vaccine. It wasn't released to the public as yet, and it was really difficult. I thank the Lord that I got through alive. And you know women, it generally needs to have something in place, a policy in place, generalized, and if you're in the healthcare field, even more emphasis, because the quality of life after you go through such a high stress job like nursing, medicine, you're in other areas and like the police service, or other jobs that you've been working in for years. When this time comes, you need the support. This is a way of supporting women. And as they were saying, if you decide, well, I want to work after the age of 55, that would be up to you. But you give you that the full benefit from the age of 55 to go home and have a have the kind of life, the quality life, and rest, and to get through this aspect of your life in a peaceful and unrespectful, caring manner, you know. So there should be things in place. We need a policy in the workplace in Trinidad and Tobago, and it's something I think women should push for. Right. So we know that the menopause transition also has lasting effects on women's health later on in life. So it is not just what we are going through now. The effects of actually going through this has lasting lifelong effects. Specifically, the sudden drop in estrogen associated with menopause has been shown to trigger an inflammatory reaction in some women that leads to dramatic decrease in bone mass. And this condition, which is osteoporosis, is characterized by thinning of bones and an increased risk of debilitating fractures. We can think about, just go through probably on one hand, a relative, a friend, or somebody, or you know, or even a patient that you engaged with or you looked after that had a fracture at that stage in their life, and how some women, they, because of how bad the fracture is, their lifespan had been cut short because of how severe the fracture, the hip was, or whatever, how severe the fracture was in the first place, right? So it is a serious, very serious issue for women. And a lot of women, they have so much responsibility still at that age. Some women still, you know, trying to get their homes. You have a lot of bills to pay. You're sending children to college, university still. You know, some people, they don't have that, but they're taking care of their elderly parents. So much responsibility that many times their health starts to decline while seeing about relatives. And I've seen that happen to some of my colleagues. They've seen about relatives, and they came and they passed even before the person that they were looking after. So it is a real time stressful time in terms of you know, what your body can put out at that stage after working so hard, you know, and going through so much changes, right? And additionally, the loss of estrogen and vasomotor disturbances combined with sleep disruption and the potential weight gain increases the risk of cardiovascular disease, which is the leading cause of death among post-menopausal women. And ladies, I would want to suggest, take a moment and think about this. Cardiovascular disease is the leading cause of death among post-menopausal women. Think about it. You know, before you used to think, you know, when you think about heart attack, you think about a man getting it, he holding his chest at middle age, and you know, he got a, you know, they get you get a heart attack. But in terms of postmenopausal women, that death has become much more in that stage. So the onus now, ladies, is really on us at this stage to put things in place for us to make it through this transition. Right? So it is a very vital topic. The onset of an intensity and duration of menopause, so also symptoms can vary from one woman to the next. It can be influenced by factors such as your diet, right? And we know that we've discussed that in depth in previous topics. It is influenced by our exercise level, activity level. If you're a smoker, your smoking status, your weight, body mass index, your socio-economic status, ethnicity, and your present or concurrent health issues, right? So we see that it is not just one thing. It can be menopausal symptoms can be exacerbated by what we are actually experiencing with lifestyle chronic diseases like diabetes, high blood pressure, if you have heart problems, have issues with your thyroid and you're going through menopause, it can make these symptoms much more intensified if you do not put the right, get the right help and put the right things in place. So at this stage, we know how important it is to put things in place. Research indicates that women, Black women, Hispanic women, for example, tend to report more vasomotor symptoms, and we know the vasomotor symptoms are the hot flashes, the night sweats, and they are more intense and frequent with women, with Black women and Hispanic women, and more than our white counterparts. The study of women's health across the SWAN study further highlights that Black women in the US tend to reach menopause a year earlier than our white counterparts or women of East Asian descent, and experience symptoms for up to 10 years, which is 3 years longer than the national average. So think about the amount of years of this stress that we are going through, and we are not getting the help that we need. So hence the reason why I'm here and I'm bringing this information to us, because it is so important that we at least have the basics down and we are able to really help ourselves through our conversations, through knowledge, the knowledge base that we're getting here, to make that push for a better level of existence, because of what is not put in place for women is not taken. Menopause is really not taken as a serious topic, and hence the reason why there are not things in place in our country to help support women at this stage, right? So I want to ask anybody else who has anything to say, interject what points you would like to put in here before we close off. This topic is so timely. I think we might just have to do a part 2 of this, right? In terms of what the impact of menopause on our life, our work life, our home life, what could be put in place through policies and things like that. Anybody would like to interject any more ideas before I close off tonight?
Good night.
Good
I
night,
don't have any ideas, but I could attest to the menopause, perimenopause, affecting my blood pressure. Because yesterday I had to go to the doctor and blood pressure level was just going up, up, and heart checking. And they had me there for a while until it ended up. So it really does affect it. And I really get the hot flashes. I got so often in the night, sometimes 6 times in the night. I get the hot flashes. So yes, I could attest what it is here.
And one of the things that happen because of the decrease of estrogen and the progesterone, that our blood vessels become stiffer, and it is more challenge for the blood to pass through the blood vessels if they are stiff like that and they're not flexible, not dilating. It could cause the pressure to go up, and if you have lifestyle issues, you're not eating the way you should, not exercising, you're not taking the right supplements, that because at certain supplements would help with that, like the magnesium glycinate, 2 to 3 hours before bedtime. It helps with the the relaxing of the blood vessels. And when taken consistently, because we at this stage, at postmenopausal stage, menopausal stage, magnesium levels are not what they used to be. So hence the reason why magnesium glycinate is so vital. That is one of the supplements that you would always hear me saying that we need at this stage in our life, Candice. So I don't know if you have already started it.
I had started it, but I stopped for a while. So what I will do, I will continue.
Yes, yes, it is important. The consistency is the key. I don't know if you made any changes in terms of your eating, and if you're staying with that, if you had made some changes in terms of lifestyle, if you have started any form of exercise, which is so vital at this time, so the changes that you need to make, and you have to really make a real effort in. Once you tell your doctor, look, I want to start exercising. Is it okay for me to start walking and doing light weights, and 2 to 3 times for the week? You can even go on YouTube, or you go online and you get a exercise program, a 15-minute exercise program. Start small.
I do exercise also. But,
Huh?
I said I do exercise, but like in monthly periods, cycling to come, and it's not coming, so it was like spotting. And then this week was just like, everything was just like haywire. It just sent up the blood pressure right up and stuff like that. But I do exercise, yeah.
Okay, you do exercise, and you exercise on a regular basis?
Yes, I do, yeah. And it's 2 to 3 times a week.
Okay, you use weights?
Yes, I do, yeah.
All right. So, and you start to engage in resting more in the night. Because it would affect, blood pressure would be higher too if you're not sleeping well during the course of the night. And the magnesium would help you to sleep much better, which will in turn affect your blood pressure in a more positive way. It will help you to go down, to reduce it. But you have to be consistent, Candice.
I will do that. I will try and get it by tomorrow and try and be consistent.
So, how you take it? Pardon me?
Go ahead. You can go ahead.
I just was asking you, how do you take the magnesium? You take it any time of the day? You take how do you take it?
2 hours before I go.
All right. Before you go to bed?
Yeah.
Right. So that is how you take it. And as you say, your problem is that you're not consistent. So you have to take it.
Yeah.
Yes, you have to take it consistently. Right? And you could another important supplement to use at this stage too is the vitamin D3 and K2 as well. Right? Very, very important. And we could always, what I will do, I'll go back on a program with these supplements and how effective they are in helping us through this, deal with a lot of these symptoms during the transition. Right? With some of the best supplements first to take, and the best time of the day to take them, what not to take it with, and things like that. Right? So you could get the help that you need in order to organize and feel more vital and healthy. All right. So, ladies, I want to thank you again for joining us tonight. I am Nurse Maria, Nurse Joseph, a sexual health nurse, a registered nurse and midwife, who is my purpose now has been to help women like myself go through this important transition. And it would be nice if we could push to have policies in place in the workplace for us to to have a better standard of living a life during the workplace and afterwards as well. So I want to thank you for making such wonderful contributions, ladies. The points are vital, and thanks again for coming again to the Healthy Reset. Invite a friend, and subscribe, the channel so that it will continue growing, and the message will go out to more and more women who need this support. So have a good night all. Until next week.
Good night.
Good night, ladies.
Good night, Maria.
Good night, Cynthia.
Bye.
I didn't hear you early on.
Jumping late.
Okay.
That's all right.
So